Hi everyone, I'm Sir July, and for this slide sets, we will be discussing the transmission-based precautions. As mentioned in our discussion in standard precaution, the isolation guidelines contain a two-tiered approach. The first is the standard precaution. The transmission-based precaution is the second tier of basic infection control. The transmission-based precautions are used in addition to standard precaution for clients with known or suspected infections that are spread in one of three ways: by airborne, by droplet, or by contact. As a throwback, the standard precaution is used in all patients regardless of infection status. The transmission-based precaution is an additional protection for patients with known or suspected infection. The three types of transmission-based precautions may be used alone or in combination, but always in addition to standard precautions. Airborne precaution prevents transmission of droplet nuclei measuring less than or equal to 5 micrometer or dust particles that contain the pathogen. These nuclei and particles remain suspended in the air for an extended period. Examples of patients where airborne precaution is used are patients with measles or rubella, varicella including disseminated zoster, and tuberculosis. Let us bring a throwback slide to help us remember the diseases included in airborne precaution. I already mentioned to you during our discussion for the chain of infection that I remember the airborne precautions as my mnemonic: airborne, meaning blown over great distances. So that includes measles, which sounds like missiles; chickenpox, imagining a flying chicken; disseminated herpes zoster, taking into account that disseminated means spread throughout; and for PTB, imagine the aerosol being blown over great distances. Under airborne precaution, the patient is placed in an airborne infection isolation room or AIIR. The private room has negative air pressure, 6 to 12 air changes per hour, and either discharge of air to the outside or a filtration system for the room air. Since the room has negative pressure, that is, less pressure compared to the outside, when the door is opened, the movement of air would be from the outside going inside. The air is force suctioned out from the room and passes through a filter. Such filter is referred to as HEPA, or High Efficiency Particulate Air Filter. If AIIR is not available, place client with another client who is infected with the same organism. Wear an N95 respirator mask when entering the room of a client who is known to have or suspected of having primary TB. Limit movement of client outside the room to essential purposes only. Place a surgical mask on the client during transport. This is an example of a signage placed on the doors of patients with airborne precaution. It reminds healthcare workers to clean their hands, including before entering and when leaving the room, put on a fit-tested N95 or higher level respirator before room entry, and to remove the respirator after exiting the room and closing the door, and to remind them that the door to room must remain closed. These are the salient features of airborne precaution. So the room must be Airborne Infection Isolation Room or AIIR. PPE is N95, and for transport, transport only if absolutely essential. During transport, have the client wear a surgical mask. Droplet precaution is often indicated to prevent transmission of particle droplets size more than or equal to 5 micrometer that are dispersed by coughing, sneezing, talking, or suctioning. Just to emphasize, droplets measuring less than 5 micrometer would involve airborne precaution, while droplets involving more than or equal to 5 micrometer would involve droplet precaution. Droplet precaution is employed in diphtheria, Mycoplasma pneumonia, pertussis, mumps, rubella, streptococcal pharyngitis, pneumonia or scarlet fever in infant and young children, and pneumonic plague. Since repetition is good for memory, let us bring a throwback slide. To remember the common infections with droplet spread, we use the mnemonic droplet, that is DRP for let, D for diphtheria, R. rubella, and the 4 P's for pertussis, parotitis, pneumonia, and pharyngitis. Place client in a private room, and if a private room is not available, place client with another client who is infected with the same microorganism. Wear a mask if working within 1 meter or 3 feet of the client. Eye protection when entering room is also recommended. For droplet, remember that the size of the particle is more than or equal to 5 micrometer, and thus they are not suspended in the air. When coughing or sneezing, a patient may disperse the droplet up to 1 meter or 3 feet, thus that is the limit of the distance for the droplet precaution. Limit movement of client outside the room to essential purposes. Place a surgical mask on the client while outside the room. This is a sample signage placed on the doors of patients with droplet precaution. It reminds everyone to clean their hands, including before entering and when leaving the room, and to make sure their eyes, nose, and mouth are fully covered before room entry, and to remove the face protection before room exit. Notice the difference between airborne and droplet precaution. In airborne precaution, the N95 mask is removed after room exit, while in droplet precaution, the PPEs are removed before room exit. For the salient features of droplet precaution, place the patient in a private room, and healthcare providers should wear masks and eye protection. Transport must be limited to essential purposes, and during transport, have a client wear a surgical mask. Contact precaution is indicated to prevent transmission of epidemiologically important microorganisms by direct contact with client's skin or indirect contact with contaminated items or surfaces. Diseases spread by contact transmission include GI, respiratory, skin or wound infections or colonizations with multidrug resistant bacteria, specific enteric infections such as Clostridium difficile, E. coli, Shigella, hepatitis A, for diapered or incontinent clients, respiratory syncytial virus or RSV, parainfluenza virus, or enteroviral infections. Also, it includes highly contagious skin infections such as herpes simplex virus, impetigo, pediculosis, and scabies. Place a client in a private room. If a private room is not available, place client with another client who is infected with the same organism. Wear gloves as described in standard precaution, and wear a gown when entering a room if there is a possibility of contact with infected surfaces or items, or if the client is incontinent or has diarrhea, a colostomy, or wound drainage not contained by a dressing. Limit movement of client outside the room, and dedicate the use of non-critical client care equipment to a single client or to clients with the same infecting microorganisms. This is a signage placed on doors of patients with contact precaution. It reminds everyone entering the room to clean their hands, including before entering and when leaving the room. It also reminds healthcare providers and staff to put on gloves before room entry and discard the gloves before room exit, to put on the gloves before room entry and discard gown before room exit, and do not wear the same gown and gloves for the care of more than one patient. It also reminds healthcare providers to use a dedicated or disposable equipment and clean and disinfect reusable equipment before use on another person. The salient point of contact precaution is to place the patient on a private room and for the healthcare provider to wear gown and gloves. Patient's movement must also be limited. Remember, the transmission-based precaution is used in addition to standard precautions for clients with known or suspected infection. Cosure specifies that for a generalized petechial rash with fever and a history of travel in an area known to have viral hemorrhagic fever, droplet and contact precautions are used until viruses such as Ebola or Lassa have been ruled out. Cosure adds, airborne precaution should be initiated if a maculopapular rash with fever, cough, and nasal congestion is present and rubiola has not been eliminated as a possible cause. It underscores the need to use transmission-based precautions every time infection is suspected. So that's it. Let us summarize. The transmission-based precautions are used in addition to standard precaution for clients with known or suspected infections. All patients must be placed in a single room. For airborne precaution, an AIIR is used, but for droplet and contact, a private room is sufficient. If a single room is not available, patient may be roomed in with a client with the same microorganism. For the PPE, we use N95 mask for airborne precaution, mask and eye protection for droplet precaution, and gown and gloves for contact precaution. In all transmission-based precautions, transport must be limited only to essential purposes. Pause this video, gather your thoughts, and when you are ready, let us have a practice test. Which of the following should be practiced by a nurse caring for a patient with PTB? A. Standard precaution. B. Standard and contact precaution. C. Standard and airborne precaution. Or D. Standard and droplet precaution. You have 5 seconds. And the correct answer is C. Standard and airborne precaution. Remember that the transmission-based precautions are always used in conjunction with the standard precaution. N95 masks are used as part of A. Standard precaution, B. Airborne precaution, C. Droplet precaution, or D. Contact precaution. You have 5 seconds. If you answered B. Airborne precaution, you are correct. In droplet precaution, which must be worn by the nurse when entering a client's room? A. N95 mask, B. Powered air purifying respirator, C. Gown and gloves, or D. Mask and eye protection. You have 5 seconds. And the correct answer here is D. Mask and eye protection. Options A and B are used in airborne precaution, while your gown and gloves are used in droplet precaution. In a patient with Clostridium difficile infection, which transmission-based precaution is used? A. Airborne, B. Contact, C. Droplet, D. None of the above. You have 5 seconds. B. Contact is the correct answer. If you got all 4 questions correctly, then you did a good job. If not, you may rewind the video to look for your answers. That ends this presentation. Please do not forget to subscribe to my YouTube channel, Memory Aid Nursing. Thank you.